So the most shocking fact about pneumonia is that a lung lobe that is completely filled with pus and fluid can transmit sound better than a healthy air-filled normal lung. This phenomenon leads to the classic high-yield physical exam findings of lobar pneumonia, when a lobe of the lung becomes densely filled with inflammatory exudate, a process that we call consolidation. It turns from a spongy air-filled organ into a solid, fluid-filled medium. Sound travels much more, that's physics, sound travels much more efficiently and clearly through a solid or liquid than through air. We know it from physics from the school. So this leads to three distinct auscultatory findings. Write it, please. So first, bronchial breath sound, bronchial. The loud, harsh sound or air moving through the trachea and large bronchi, which is normally filtered and muffled by healthy air-filled lung tissue, is now transmitted directly and clearly to the stethoscope. Hearing these sounds in the periphery of the lung is abnormal and indicates, yes, consolidation. So we hear the sounds not in normal place, but in the periphery of the lung. It's signs of consolidation, that's i.e. pneumonia. Egophony. Second point, egophony. When the patient says the letter E, the consolidated lung tissue filters the sound in such a way that the doctor hears the letter A. Through the stethoscope, E to A change. Next, increased tactile fremitus. When the patient speaks, the vibrations from their larynx travel down the airways. So a solid consolidated lung transmits these vibrations to the chest wall much more effectively than air-filled lung. Therefore, when the doctor places their hands on the patient's back, they will feel stronger vibrations over the area of pneumonia. Yes, we can say it's a completely counterintuitive. Common sense would suggest that a sick fluid-filled lung would produce muffled, distant sounds. The reality is the exact opposite, vice versa. It acts like an amplifier. Next, it's a beautiful demonstration of physics. It's a perfect clinical example of the physics of sound transmission. It turns a simple physical exam into a fascinating scientific experiment. It's a powerful diagnostic clue. In the age of the chest X-ray, these physical exam skills are sometimes overlooked. However, recognizing this science at the bedside can allow a clinician to make a highly confident diagnosis of lobar pneumonia before any imaging is done, which is crucial skill in low resource settings or at the point of a first contact.